Good afternoon, madam. Please have a seat. You look a bit worried. What brings you in today?
Good afternoon, doctor. Yes, I've just been feeling off lately. I don't know if I'm overthinking, but I've been hearing a lot about cancer, especially people catching it late. I wanted to understand what early signs I should watch for.
I'm glad you came. Many people ignore symptoms until they become serious. Cancer doesn't always shout at the beginning. Sometimes it whispers. The key is paying attention to changes in your body. So tell me, have you noticed anything unusual with your weight, appetite, energy, or your skin?
Well, I've lost a bit of weight in the past 2 months, even though I'm not dieting, and I get tired a lot even after sleeping well.
Thank you for sharing. Sudden, unexplained weight loss and persistent fatigue can be early signs. Not always cancer, but they deserve attention. Let's go through the common early warning signs so you know what to look for.
Okay, please.
All right. One of the most common early signs is a persistent lump in places like the breast, neck, or testicles. If you feel a lump that doesn't go away, especially if it's painless, it's something to check. Another one is unusual bleeding, like blood in stool, urine, persistent coughing of blood, or abnormal vaginal bleeding. Have you experienced anything like that?
No, none of those. I check sometimes because I'm paranoid, but nothing like blood.
Good. Another sign. If you have a persistent cough that lasts more than a month, especially in people who smoke, some people think it's just malaria or catarrh, and they ignore it. Also, any difficulty swallowing or food getting stuck in your throat repeatedly should be examined.
I've had some heartburn, but swallowing is fine.
Good to know. Next, changes in your bowel habits. For example, stool becoming very thin like a pencil, persistent constipation or diarrhea that doesn't resolve. Also, pay attention to changes in moles or patches of skin. Maybe a mole getting darker, bleeding, or increasing in size. Do you have any skin changes?
I have a tiny dark spot on my arm, but it hasn't changed much.
If it stays the same, it's probably harmless, but keep an eye on it. The rule is, if it changes in size, shape, or color, check it. Another important sign, persistent pain. Not the usual body pains after stress, pain that stays and has no clear cause.
Okay, I see. I've had some back pain, but I sit a lot at work.
That could simply be posture. Cancer pain is often persistent, progressive, and doesn't respond to normal painkillers. Next, persistent indigestion, bloating, or feeling full very quickly, even when you haven't eaten much, especially in women. And finally, unexplained fever or night sweats that won't go away. These are general signs. They don't mean someone has cancer, but they're reasons to investigate.
Doctor, that's a lot. It sounds scary.
I know it can sound scary, but knowledge gives peace. Not every symptom means cancer. Most times, there are simpler explanations, like infections or hormonal changes. But catching cancer early gives the highest chance of cure. That's why awareness is important.
So, what should someone do if they notice any of these things?
Simple. Don't panic. Don't self-medicate. Come for evaluation. We run simple tests depending on the symptom. Blood work, scans, or biopsies. Most times, people are fine. But if something is there, early treatment saves lives.
Are there cancers that show no signs at all?
Yes, that's why screening is important, especially for breast, cervical, colon, and prostate cancer. Many cancers are silent until late. That's why routine checkups are powerful.
So weight loss and tiredness could be early signs, but also something else?
Exactly. They could be caused by stress, infections, thyroid problems, or diabetes. That's why we investigate, not assume.
Understood. Is there anything I can do to reduce my risk?
Absolutely. Don't smoke, limit alcohol, eat more fruits and vegetables, stay active, maintain a healthy weight, protect your skin from excessive sun, get screened early. These small habits make a huge difference.
Thank you, doctor. This makes me feel more informed, not afraid.
Good. That's the point. Cancer isn't always a death sentence, especially when detected early. If anything changes in your body and you're unsure, check it. It's better to ask questions than ignore symptoms.
I'll be more attentive. Thank you.
You're welcome. Let's run a basic check today to be sure everything is fine.
So, doctor, if someone has a family member who had cancer, does that mean they'll also get it?
Not necessarily. Family history increases the risk for some cancers, like breast, ovarian, or colon cancer, but it doesn't guarantee you'll get it. Think of it like having a higher chance, not a certainty. Healthy lifestyle plus regular screening can help prevent or detect it very early.
Okay. What about people who don't have symptoms? Should they still get screened?
Yes, especially after certain ages. For example, women should start regular cervical screening from their mid-20s. Women should start breast screening from their 40s, earlier if there's family history. Men should check their prostate from about age 40 to 45. Colon cancer screening usually starts around 45. Screening helps us catch silent diseases early.
A lot of people don't like hospitals, though. They're scared of what they might find.
I understand, but here's the truth. Fear doesn't stop disease. It only delays treatment. Most times, it's better to know early when treatment is easier than late when options are fewer.
That's true. I guess the fear comes from thinking cancer means death.
20 years ago, that was common. But today, many cancers are treatable and even curable when caught early. We've made huge progress in surgery, targeted therapies, and immunotherapy. Some people go on to live long, healthy lives after treatment.
That gives me hope.
Good. Also remember, lifestyle plays a huge role. Smoking, alcohol, processed meats, obesity, and lack of exercise are major causes. Things like stress alone won't cause cancer, but they can weaken your body over time.
I know people that prefer taking herbs first.
Herbs are not automatically bad. Some can help with symptoms, but relying only on them without proper evaluation is risky. Many people lose precious time that way. If cancer is found early, treatment is much simpler and less expensive.
Makes sense. Thank you for explaining everything gently. It's scary, but at least I feel informed.
That's the whole aim. Awareness without fear. Listen to your body. If something feels unusual and persists, don't ignore it.
I'll keep that in mind. Thank you, doctor. I appreciate it.
You're welcome. You're doing the right thing by coming early. Let's take it one step at a time. I'll have the nurse guide you for the blood tests. They're simple and should give us a clearer picture. Once we have the results, we'll talk again and decide the next step.